Hello and welcome everyone to the Conscious Clinician podcast. This is episode number 1. I'm Dr. Michael Gaeta. Greetings from the Gaeta Institute for Holistic Health Education. The purpose of this series is going to be to provide perspectives on holistic healthcare with an emphasis on natural health and also healthcare freedom, and also provide some perspectives on current events related to healthcare and other issues. So today for this first episode, wanted to look at the current COVID situation. We can't really call it a pandemic anymore because that ended months ago in terms of death rate and mortality rates. But there is still an ongoing situation. So what I wanted to focus on today was the renewed wave of lockdown quarantine measures in many states and countries, and what that's about, why that's happening, and why it's a supremely bad idea. So the apex of the pandemic was back in March and April, and there were many people who were sick, many people who died, and now several months later, or 9 months past March, now here in December, and also Merry Christmas to you all, we are in a very different place. And the place we're in now is that there are very few the death rate, the mortality rate per whatever capita, whether it's 100,000 or a million, is quite low. And we are in the range of annual seasonal flu in terms of death rate. And because the death rate is so low, the media and mainstream medicine is propagating fear. They're not talking about deaths as much or hardly at all. Now they're talking about cases. And so rather than a pandemic or an epidemic, we have a case-demic, where we have an increase in cases, and I'll explain why, without really a parallel increase in deaths. So for example, if you had an increase, say you had a 25% increase in cases, you should see a 25% increase in deaths per capita. Well, that's not happening. And this is today's December 14th, 2020. And so what is happening is that cases are almost always someone who is not actually sick, someone who is completely asymptomatic. They're healthy, they're not sick, yet they're declared a case because of a extremely unvalidated and truly actually irrelevant testing procedure. So the two things, and I was just on the phone with Boulder County. I'm here in Boulder, Colorado, and the Boulder County Public Health, I just spoke with them last week, and I said, well, what's a case? And their answer is going to be pretty identical for most health departments all around. But they said, well, a case is someone who tests positive with the PCR test, the so-called molecular test, which stands for polymerase chain reaction test, or its full name RT-PCR, reverse transcriptase polymerase chain reaction test, which is a brilliant and ingenious test for doing research and a completely irrelevant test for medical diagnoses or clinical diagnosis. And that's coming from the creator of the test, the brilliant scientist, Kari Mullins, who created this test in the 1970s and completely revolutionized the field of medical research. It's a brilliant test for that purpose. And so this test is being used for what exactly it wasn't designed for and what it hasn't actually been validated for, which is medical diagnostic testing. And so we have people who are not sick, almost all. Some people are definitely still getting sick. We still have some deaths, and every death is tragic. But in the main, we have an extraordinarily low death rate. According to CDC, we have about a 99.97% recovery rate if someone develops COVID-19. And we have, really just an increase in cases primarily. Now, the diagnosis of a case is based on the PCR test or usually a medical doctor, someone who's licensed to diagnose disease, just subjectively deciding that the person has COVID without any testing. Now, the common symptoms of COVID-19, as you may know, there are many, because it can affect most tissues and organs of the body. So it can be very insidious, it can become chronic, and it can be fatal. But the primary symptoms is cough, fever, fatigue. That could be, dozens of possible causes, and possible loss of taste and smell, because the body's viral defense against the virus depletes zinc. And when zinc is deficient, you lose your taste and smell. Whether you have COVID-19 or whatever, you have loss of taste and smell. So, and that's why zinc in the treatment protocols is so effective, because you're replenishing the depleted zinc stores that have been used up to combat the virus. So we have really a situation where the epidemic is over. Very few people are dying. The survival rate is extremely high. We're well into, according to most experts, well into herd immunity range. And in most states and also countries on Earth that have had a significant number of cases. And we have this truly unjustified, truly detrimental, and truly unwarranted and harmful lockdown quarantine renewal based on an unvalidated, inaccurate, riddled with false positives test and the subjective diagnosis of a health professional. Most folks, if you have a cough, oh, that must be COVID. Oh, I have a fever. Oh, that must be COVID. Even without any testing done. And we don't really yet have a validated test. The antibody test also riddled with false positives. And but most of the reliance, and that did pick up some speed, the antibody test. But now there's a primary reliance on the PCR test, which has not been validated. And famously, Elon Musk, the entrepreneur and CEO of Tesla and other companies, got 4 PCR tests on the same day with the same nurse on the same equipment with the swab up the nose, and 2 tests were positive and 2 tests were negative. And he rightly concluded that there are some serious problems with, if we're relying on this test for anything. This is an extremely unreliable and certainly unvalidated test. And so we have a case-demic leading to unjustified and harmful lockdown quarantine measures, destroying the economy, destroying people's lives, keeping children out of school, which is completely unnecessary and extraordinarily detrimental. Here in Boulder, at least, if you want to find a therapist, a psychotherapist, good luck. And this is true in many cases. And Boulder is loaded with psychotherapists. Like, you literally throw a stone and you will have a pretty good chance of hitting with your little rock a psychotherapist. There's tons of psychotherapists in Boulder, which is fine. But you can't get an appointment with almost all of them, because there is so much anxiety, depression, despair, suicidal ideation, suicide, violent behavior. There's just a complete epidemic, a true epidemic of mental health issues. Not caused by the virus, caused by the government response to the virus. So at this point, the government is much more dangerous than the virus. The virus is a thing, we think. We're not actually sure if it exists, because it doesn't meet any of Koch's postulates for pathogenic causation. So we don't really, and it has never been isolated yet in a human being. It's only been identified in the lab. So there are serious scientists and physicians who are questioning what this thing is. Does it exist? What is it? Where does it come from? And what effects does it have on the body? But we're going to go on the presumption, which is being, I think, understandably challenged. But we're going to go on the idea that there is a COVID-19 virus, that it is making people sick, that a few people, nationwide are dying still, nothing like it was in the spring. And that we have a very low mortality, high survivability epidemic, or former epidemic, that the only appropriate thing to do at this point is to open things up, open everything up, stop destroying businesses and restaurants and lives and families and friends and children's education and children's mental health with these needless measures. If you look at California, I'm sorry, not California, if you look at Florida, if you look at South Dakota, if you look at Sweden, if you look at other locales, nations and states, where they have not locked down, they have not destroyed the economy, people still live their lives and are allowed to just decide what risks they're willing to take, the statistics are dramatically better than the strict lockdown quarantine states without exception. So what I wanted to share with you today is a paper that was just published. It's a very significant paper on challenging, which is challenging validly, this unvalidated reverse transcriptase PCR test. So let's take a look at that and see what we're really looking at in this situation. So let me pull this out and okay, here it is. Okay, so this is a website, CormanDrostenReview.com, and this is a consortium from around the world of highly respected scientists and physicians who are questioning the wisdom of a global lockdown based on a flawed test. And the thing they do here, and this just came out a couple of weeks ago, so it's very new, and this is a critical scientific critique of the Corman-Drosten paper, which was and has been used as the procedural methodology as well as the justification for using the molecular PCR test to diagnose a case of SARS-CoV-2. And this is a highly technical paper, extremely technical paper. Even if you have medical training, this will hurt your brain. If you don't, there's just going to be some things which won't make sense. But these are highly respected physicians and scientists. And what are they saying here? External peer review of the PCR test. 10 major scientific flaws at the molecular and methodological level, consequences for false positive results. And just want to highlight a couple of things here, which I think are quite significant. And what this is the recommendations here, and I want to highlight some of the highlights here. Neither the presented test nor the manuscript itself of the study fulfills the requirements for an acceptable scientific publication. Furthermore, serious conflicts of interest of the authors are not mentioned. The very short time scale was an issue, and we provide a systematic peer review process really not performed here or of poor quality. We provide compelling evidence, which they do, of several scientific inadequacies, errors, and flaws. And so this is a very scientific, scholarly smackdown of the test that is now being used as the false justification for locking down the world again. And it goes on. This paper will show numerous serious flaws in the Corman-Drosten paper, which is the foundational paper for the PCR test for SARS-CoV-2. The significance of which has led to a worldwide misdiagnosis of infections attributed to SARS-CoV-2 and associated with the disease COVID-19. We are confronted with stringent lockdowns, which have destroyed many people's lives and livelihoods, limited access to education, and these imposed restrictions by governments of the world are a direct attack on people's rights and their personal freedoms, resulting in collateral damage for entire economies on a global scale. which is absolutely true and absolutely astounding. And so these lockdowns, which were never justified, has caused much more harm and illness and death because of global interruptions in the world food supply, and literally destroyed people's lives and livelihoods. Businesses, I can name several here in Colorado, that were built over decades, which have been shut down, never to reopen. And for what? Something that currently, it's not March or April anymore, has the mortality risk of the annual flu. We don't lock down the planet every year for the flu, but that's what we've got right now in terms of death rate. And this virus is, can be very devastating. If it exists, it can be very devastating, but we have no validated testing. And this is a classic example of government overreach in the extreme, the greatest mistake ever made in public health in human history. The first time ever in human history that healthy people have been quarantined. It's been done for millennia. Separate out the sick people. Somebody's sick, separate them from the healthy people as much as you can to try to minimize spread. This has been done for centuries at least. It's the first time we've quarantined or separated from each other healthy asymptomatic people. And this is it's useless. It's completely unjustified. And here's an example of where the cure, so-called, is far worse than the illness. And I'm not saying nobody's gotten sick. I'm not saying nobody's died. But I'm saying at this point, on December 14th, when we had, the peak of this, thing got rolling apparently in December, and then peaked in March, April, has declined since then. Most areas went below epidemic level in terms of mortality in June, and we're 6 months past that. So what we have is an extremely dangerous situation, not from the virus, but from the government. And so what's needed right now is, and this paper that we just looked at, that was just the introduction. It gets extremely technically detailed. If you're a scientist or have medical training, you're going to love this paper. I really enjoyed, reading the details because they really did a superb job on this. And again, you can find this at cormandrostinreview.com. And they also, on this same website, have an excellent article. And what they're calling for is a retraction of that original paper that was used to validate and justify and lay out the methodology for the PCR tests. And so this other bit summarizes a lot of things that I've been saying very eloquently, and it's also at the same website. And this is false positive consequences, because we have loads, the estimate is at least 50% false positives with this bogus, unvalidated, completely useless PCR test. And basically, if without getting too technical, you amplify, you take a little piece of RNA and you amplify, this becomes DNA, and then you amplify the DNA. I believe that's how the mechanism is. And you amplify it a certain number of times using light. And it's a very ingenious test. But if you amplify the sample 10 times, for example, nobody tests positive. If you amplify the same sample 60 times, everybody tests positive. In other words, if you amplify anything enough, it will resemble some piece of the alleged SARS-CoV-2 virus. So this is, what's being done. And so let's look at this. This is, again, from the Cormand-Drostin Review. And let's just look. I want to highlight a couple of things from this paper that I think are significant. And so what we have here, this is an incredible excerpt. Additionally alarming, especially pertinent to this argument, is the PCR test has impacted all levels of global society, as perhaps no test has ever done before, are the unforeseen consequences caused by the rise in PCR cases. Again, these people are not sick. They're asymptomatic. Almost all of them. Certainly there are some that are symptomatic, but the vast majority are not. And so, we have to keep this in mind. I had a patient recently who had gout. He had a case of gout. How did we know? He had all the clinical signs of gout. His big toe was like twice the size, very red, very swollen, very painful, extremely difficult to walk. He was limping around, using a cane, in terrible pain. And thankfully, using what I do, natural functional medicine and Chinese medicine, he was dramatically improved within a week or two, and now, he's been fine for a couple of months. So it resolved pretty quickly. But he was a case of gout. Now, we knew, and he was diagnosed with gout by his medical doctor, and the patient didn't want to take the steroids and such. And there was a test they did, it's a blood test for uric acid, which is often elevated. In people with really any inflammation anywhere, uric acid can be elevated. But this is often used as a confirmation test for gout, where there's uric acid crystals that build up often in the big toe, but really in just about any joint. But his was in the classic kind of big toe. So we had a test that kind of backed it up, confirmed it, but it was a clinical diagnosis. His medical doctor made a clinical diagnosis, accurately so, you have the gout, because you have all the symptoms, and this looks a whole lot like gout. And he made an accurate diagnosis. And then he said, let's do some blood too. And sure, okay, the uric acid was like 9, shouldn't be higher than 5, and that was confirming. But he was a case of gout based on a clinical presentation, not merely a test. And so now, and those are symptoms that are fairly unique. I mean, it's possible it's rheumatoid arthritis. There could be other things that cause those symptoms, or possibly osteoarthritis, but not really. But so there are other things that could have caused those symptoms, not that many. But now, so you couldn't possibly imagine to diagnose somebody with COVID-19 just based on a cough and a fever, because that could be anything. With gout, it's pretty narrowly specific, like, there aren't a lot of things that would cause these exact symptoms in this exact way. So we have people who are being diagnosed as a case of COVID-19 based solely on an invalidated test. So let's continue in this article, the consequences of false positives. Over 100 governments have used these results to apply unprecedented measures. Why are these measures unprecedented? Because they don't work. To control transmission, such as lockdowns, which have irreparably impacted millions of lives and livelihoods, and direct attacks on people's basic rights and personal freedoms, further resulting in catastrophic damages for entire economies. The big economic crash of 2008 was nothing compared to this. What we're experiencing now is already 3 to 4 times worse than the economic crash and recession of 2008. So this is huge. And in the literature, continues. In literature of PCR testing is known there are many dangers, such as operational false positives that can lead to a misinterpretation of test results. And so it is recommended that PCR should only ever be used in tandem with a clinical diagnosis of infection based on symptoms. And this has happened before, documented occurrence of misinterpretation that have led to phantom pandemics, which is what we have now, a phantom pandemic. For example, 2004-2006 respiratory illness outbreak mistakenly attributed to pertussis via use of, again, the completely useless for clinical diagnostic testing, PCR test. And so, this is truly awful what's happening here, not with the virus, but with these unbelievable government restrictions based on this completely inaccurate test. And so we have a pseudo-epidemic or a false epidemic, and we need to call this out. We're destroying people's lives, livelihoods, their mental health. We're harming children. The effects on children are devastating as adults. And this is causing global catastrophe. Again, not the virus, but the government, the state, is causing a global catastrophe. The World Bank has stated due to the pandemic measures, not the virus, due to the government pandemic measures, 88 to 115 million people will be forced into extreme poverty this year. Next year, rising to 150 million people. And this is far beyond, far worse than the virus ever could be. And I believe this case-demic was to string us along, keep people scared, hysterical, paranoid, completely in despair, until the vaccine came available, which just happened this week. Now the vaccine's available, and people are clamoring for the vaccine to save them. This highly dangerous, highly untested, completely inadequately safety tested vaccine, which no one should take for that reason. The vaccine should be completely avoided because it's improperly tested, one. Two, it's a completely new type of vaccine, a messenger RNA vaccine, which has never been used before in living things on any type of mass scale. And three, because we have very effective treatments available, both natural and pharmaceutical treatments are very effective treatments, are very safe, are available to treat people who get sick. And if you have an effective treatment, you don't need a vaccine. Also, number four, the vaccine, one of the primary endpoints has been reduction in symptoms, not even prevention, but just making symptoms a little less is considered success, which is absurd when we have very effective treatments available. And so this is very, very, very dangerous situation we have here, not because of the virus, but because of the government response, which is completely unjustified and unwarranted. So the fear tactics, this is a great section here. The use of lockdowns, the case-demic phenomena has encouraged governments worldwide to intimidate their populations into compliance with increasingly bizarre and illogical restrictions, ramping up fear tactics and all the rest of it. And so this is a complete loss of democracy and human rights. Everything that's happening violates the UN Convention on Human Rights, and they're simply being ignored. Well, it's because of the more cases based on the bogus testing. So what we need to do right now, all of us, is to get informed, and thank you for listening today, and to take action, to demand the restoration of our freedoms. What the government should be doing right now is informing people of what they know, making recommendations, and letting people decide on their own what risks they're willing to take. If a person is not willing to take a risk of being near anybody else, fine. That's their choice. If a person feels like they're not safe without these ridiculous, disproven masks, which we know are completely useless after 4 decades of medical research on them, they're useless. But if a person that makes them feel safer, oh, I'm safe because I'm wearing a mask, fine, wear a mask. But it's up to the person whether they do this lockdown, distancing. The government has no right to put the entire population on house arrest and confine them to their homes and to destroy thousands of businesses. And if you go into a restaurant where they still seat people, you can have the mask off if you're seated, but you have to put it back on if you're standing up, as if the virus was only active above 4 feet of height. I mean, none of this makes any sense, and I'm just amazed at how much people are willing to just give away their personal freedoms, rights, liberties, and personal autonomy to an overreaching and tyrannical government. It's not appropriate, and it's not based in science. The government response is not based in science or evidence or data. It's based in superstition and fairy tales. It's based in propaganda. And we need to start calling this out and demanding this. If you look back to 1969, the so-called Hong Kong flu, killed about 100,000 people that year, and in the midst of it was Woodstock, the music festival, right? And there were no lockdowns, there was no quarantine of healthy people, there was no universal masking and all this nonsense. People lived their lives, and if they were afraid, they took whatever steps they felt necessary to protect themselves and their families, and maybe staying in for a couple of weeks or whatever it was. And this COVID thing was supposed to be like 2 weeks of stay at home for 2 weeks, and this will blow over. And, you know, it took a little longer than that, but it did blow over nonetheless. And so what's needed now is that we get informed and we take action, contact our local representatives. Our elected officials have just checked out. We are now being controlled by unelected government bureaucrats with no accountability, like the health departments and such. We have several completely insane, tyrannical, science-denying governors, like Newsom, like Polis, like Whitmer, Inslee, Cuomo, Murphy, who don't deserve to be in office. They're violating their oath of office every day and should be removed from office immediately. And all of their stats of all those states are worse than other states that there are no severe restrictions on daily life, like in Florida, like in South Dakota, for example. And Florida has a very aging population. And why are their stats better than younger population states? Why? Because they're not locked down. They didn't just, for several months, they let go of the lockdown. So you can't justify this stuff and look at Florida. Florida's doing great, relatively speaking, even with the bogus inflated case numbers, even with the bogus inflated mortality statistics. And you look at Sweden, which leads the world in how they responded to it. They did not take away their citizens' freedoms. They did not destroy their economy. They didn't mandate masks. They didn't shut down businesses and restaurants. They gave people information and let them decide. Okay, how do I want to handle this? I'm terrified. I'm staying in my house. Great. I'm not scared. I'm going to live my life and do what I was doing before. Fine. That's the correct approach. And so that's what we need to demand. I'm amazed. I don't think people would have stood for this kind of crap back in 1969 with the Hong Kong flu, where the government, took over people's lives and confined them to house arrest and all of this and destroyed the economy. I don't think people would have stood for it back then. But we're standing for it now, and that needs to stop. So please join me every week. Go to michaelgaeta.com, and you will see there our weekly free webinar on Mondays, 11 a.m. Mountain Time, called Mondays with Michael. It's a free webinar on natural functional medicine and natural health and health freedom, and my perspectives and kind of weekly updates on the evolving coronavirus situation. Again, it's not an epidemic or pandemic anymore. It hasn't been for months, but the evolving situation. So I wish you well. I wish you all a Merry Christmas. Treasure each other and your families and friends and loved ones. Get together with them if you feel comfortable with that. The main thing is if nobody's sick, nobody's in danger. There is no asymptomatic transmission. There are no asymptomatic carriers. It's active illness, droplet transmission, and then World Health Organization confirmed this even. So don't be afraid and again, people are sick. You need to properly attend to that, maybe stay home. But if people aren't sick, live your life. That's what the data suggests. That's what the data tells us. That's what the evidence actually reveals. Not the propaganda, not the hysterics from the health department and the mainstream media, but the actual data, science, and evidence. So enjoy Christmas with your loved ones. You don't have to wear the masks are useless anyway, and so you don't have to bother with that unless you want to. If you feel better that way, and it's your choice. I'm saying there's not really a scientific reason to do that based on the evidence and data, but if that's how you feel comfortable, great. Off you go. That's great. Do whatever you like. You could stay at home, wear a mask inside, all that kind of stuff if you want. But I'm saying that the epidemic is over. And based on death rate, the case numbers are irrelevant and flawed. And we need to live our lives, get our economies back, get our lives back, get people back to work, get kids back to school. Every country, without exception, that reopened their schools in Europe, no adverse effects, zero. No increase in cases, no increase in deaths. Children do not, and kids who got sick, they don't transmit it to other kids. They don't transmit it to their teachers. They don't transmit it to their parents. Kids are almost always completely safe. And so children need to be back in school with each other, playing, hugging, laughing, singing, dancing, whatever kids do, all that wonderful stuff. So I wish you well. You'll find a lot more at michaelgaeta.com. That is the website of the Gaeta Institute for Holistic Health Education. I also do quite a few practitioner health professional trainings in natural functional medicine, as well as patient care by video and phone. And so you can find all the details for that at michaelgaeta.com. And you also find the Mondays with Michael, which includes Perspectives on the Pandemic, which is every Monday at 11 a.m. And if you would like the archive, we've done 39 weekly webinars on the pandemic situation, the COVID situation, and the archive of that is also available at michaelgaeta.com/immune. You can find all that there. So I wish you well, wish you and yours well, and happy holidays. Thanks for joining me for this first episode, it's kind of exciting, of The Conscious Clinician. Until I see you next time, be well.